for your audience that doesn't know the full backstory. So during COVID, Cuomo did an advisory, like where he was saying, because this started because like, there were all the experts that were saying that hospitals would reach capacity. And so the system would be overwhelmed. So like if the hospitals were like overwhelmed, then even like if random people had like heart attack or other issue, they would not be able to be treated. So that was the emergency back then. If all these people from nursing homes or in general with COVID cases would overwhelm the system. So that's when they did this advisory saying, if you're stable, if you don't need any more hospital care, then you should be sent back to the nursing home. Or, I mean, you can go back home if you're like if someone can take you home. You don't have to be in a nursing home if your family want to take you, obviously. So, but then the advisor was saying the nursing home cannot discriminate people just because they had the previous COVID situation, as long as they're stable and as long as the nursing home can properly separate them. So he wrote this advisory. And but also I want to remember, because people like always talk about this advisory, but the fact like nursing home, there were rules already in place that they were supposed to separate people. I think where people get it wrong is like they think, okay, all the people from the nursing, like from the hospital came and brought these COVID positive cases to the nursing home. But I mean, if you were even like an older person and you got COVID, they would not send you to the hospital, obviously. You would stay in the nursing home with your positivity, and they would separate you, and they would have to do all the precaution, keep in a separate room, masks every time. So not all the people that got COVID in a nursing home would go to the hospital, obviously. So where I think people like think, okay, the cases are coming from the hospital, that's where like it's like the nursing home was supposed to separate these people and treat them. And to me, if that didn't happen, it's on the nursing home. It's not on the advisory. That's where, to me, I have the issue with the thing, because the rules were in place. Like, and again, we're talking about a nursing home. We're not talking about a coffee place that like, that where people act like the nursing home is like, okay, you don't have any rules. Like there were a lot of strict rules even before COVID, because like there could be this kind of situation with any kind of disease or any kind of thing. So there are specific rules happening in nursing homes where like you're supposed to have a protocol. So if the people came from the hospital and you knew that they were positive from COVID, they could still have some symptoms, the nursing home were supposed to do the proper protocol or work with the state, because that's what they said. They could call the Department of Health of New York State, and if they couldn't properly care for them, the Department of Health would find a different solution for these people. If they didn't, it's on the nursing home for me rather than that. So, but that's the situation. So there were some people, and one of them is Janice Dean, who is like she works for Fox News, the weather. So these people, they're saying that their people from their family died in a nursing home because of like this Cuomo director, like advisory. So some people came back to the nursing home with that. So they sued Cuomo for like wrongful death. And the judge said, especially because of the timing, when this advisory was done, when the first people came into the nursing home, it's impossible that who brought these people was because of the advisory that Cuomo did. So the judge dismissed the lawsuit.